We're expecting some more people, but I think it's best we proceed to save time. So I'll just run the mic. Please take 30 seconds to just say your name and the organization you work for in terms of AT, because I think everyone here is connected to AT now.
Thank you. Klaus Höckner, Access Austria. I'm connected to AT in there are several links to AT here.
Yeah. Hi, my name is Abdelmonem Sharkawi. I'm the chairman of the National Academy of Information Technology for Persons with Disability. This is an institute at the Ministry of Communication and Information Technology in Egypt.
Hello everybody, my name is Chipo Chimundu. I'm with the Clinton Health Access Initiative and I'm working on the Global Assistive Technologies program supporting 14 countries. Thank you.
Hi, Ken White, W3C, much shorter.
What's W3C?
World Wide Web Consortia.
Focusing on accessibility.
Hello, my name is Nimmer. I'm here with Google. Thank you all, good to be here.
Hello everyone, my name is Mariah Moon, also here with Google, and I work on all of the assistive technology built into Chromebooks. Chromebooks are a Google-made laptop.
Hi everyone, Andre here. I'm with the Mastercard Foundation.
Christopher Patton, Google, Head of Accessibility and Disability Inclusion for EMEA, Africa, Middle East, and Europe.
Hi, I'm Kaylee from the MasterCard Foundation.
Hi, Debbie Spirinita from Mastercard Foundation.
Hello, I'm Bernard Shearer. I'm the director of Innovate Now and also the founder of AT for
And he gets his own mic.
Good afternoon, everyone. My name is Alalam. I'm from Ethiopia.
Hi everyone, my name is Muhyiddin Abdullah. I am Innovation Specialist for UNICEF Supply Division, which is a headquarter unit for UNICEF that is based in Denmark. And we are focused in enhancing access to assistive technology for low and middle income countries. Thank you.
Hi everyone, my name is Brian Wenda. I'm the CEO of HopeTech and also a co-founder at Sensisab, which is a research and distribution center for assistive technologies in Nairobi, but currently we cover a few countries across East Africa and setting up in West Africa soon. Thank you.
Hi. Okay. I've lost my voice. It's not a great thing when you're at a conference. I'm Pascal, and I head up AT Scale, based in Geneva.
Fantastic. And I'll give one more person to quickly introduce herself.
So sorry, I'm Dr. Susan Amithi. I'm a developmental pediatrician based at Aga Khan and also East African Academy of Childhood Disability.
And she's big on AT, so thank you everyone for joining us. I think we're going to keep this very simple because we want it to be a really good discussion. The theme for today, what we want to talk about is how to unlock the AT value chain in Africa. And you have the 4 speakers, by the way, in terms of gender. There was supposed to be a lady, and I also make up the next lady. But last minute he changed, and we had to replace her. No, you know, people look at everything. So I have to say this, at this conference, when people look at the speakers, they look at gender, they look at disability, they look at country. So you can't have, if you have 2 people from Kenya, people will complain. So, and the chain goes on and on. So yeah. So anyway, so that's what we want to focus on. How do we unlock the AT value chain in Africa? And I'm going to work hand in hand with Bernard because I'll be in and out to help moderate the session. So I think I will hand over the mic to Pascal. You share with us what you're doing, but also how do we unlock this market. It will continue to be an open discussion.
Thanks. So for those who don't know AT Scale, we're a global partnership based in Geneva, relatively new. I still consider ourselves a bit of a startup, but we have a big, bold ambition of trying to help reach 500 million more people with assistive technology in low and middle income countries. The way that we want to do that is, well, first, as our name suggests, through partnerships and collective action, because it is truly a multi-sectoral, multi-stakeholder effort. But we focus on three broad approaches, so to speak. One is, and the most important, strengthening, working with countries, partnering with country governments always as our first entry point to strengthen the whole ecosystem around access to assistive technology. The second area is around what we call global public goods, and so trying to fill gaps in normative guidance, availability of trainings, market access opportunities, so working, for example, with Supply Division, UNICEF, but also engaging with the AT industry to try to find ways to reduce prices, for example, of assistive technology. And third is around communications and advocacy and raising awareness and raising the flag for assistive technology across all sectors, in health and education and humanitarian settings, and when it comes to employment and labor discussions, et cetera, et cetera. So that's our three kind of strategic approaches. I should also say that when we talk about assistive technology, it's a wide range assortment of things. I know that in this conference there tends to be a focus more on digital assistive technology, but we're also very much looking at the more basics like wheelchairs and prosthetics and eyeglasses and hearing aids, as well as, of course, digital devices and smartphones, amongst others. So I guess that's a little bit about AT Scale. We maybe just a thought then about this conversation. In a way, I think the most important thing is to always have the AT user at the center, right? And then thinking about, okay, how do we ensure access to assistive technology to the AT user as sort of the input, in a way, and what is the whole entire ecosystem that you need, which is a lot of what we're focusing on at AT Scale, but working well with different stakeholders. And then you have the flip side of that, in a way, is the opportunity. So how do you unlock access for AT users, and then how do you unlock the opportunity so that once they do have access to assistive technology, they have then access to employment and schools and, et cetera, to enjoy the quality of life that everyone has a right to and deserves. And so I think it's, those two sides of the coin, in a way, that could be a way to frame or think about a value chain to some degree. Thank you.
Thanks, Pascal. My name is Brian Mwenda, CEO of HopeTech, and for the past 8 years I've been building assistive technologies here in Kenya and across a few other countries. Very obsessed about creating a mobility assistive device for blind and visually impaired people, and I'm very happy to announce that this year we'll finally have a product in the market. So a product that we've been building for so many years. So it's really exciting. So when I started building AT, I don't think there was even the term assistive technology. So I'd say the space has really grown in terms of support for innovators. From an innovator's perspective, I think initially there wasn't any kind of support, so we had to be bundled up with other innovators, and it was a really competitive space. Building a hardware product, building in this space, many people don't understand what AT is, and initially we had to do so many things in terms of educating investors, educating the market. So I think we really experienced so many challenges along the way. 1 year ago we set up Sensis Hub, which is a center here in Nairobi focused on research and distribution of assistive technologies, and I think this space is really biased towards the challenges that we faced building AT in Kenya and also in Africa. For example, we help other makers of assistive technologies to build products. So we have technical support engineers who help people to prototype and to quickly test with actual users. So we also engage with other stakeholders within the space. So there are regulatory challenges. I think if I go on about the problems with AT, it's going to be a really long list. But we're trying to narrow down on the big problems around creation and availing assistive technologies to people. We are creating a large network of distribution because distribution and access is a really big issue across Africa. So we're trying to partner with different people across different countries to make sure that people who need assistive technologies can actually reach it first. And then going into the next question, how do we make it affordable for them? So I don't know, in terms of the conversation here, I would really agree with Pascal. Once you put the user in the middle, then you can start solving the challenges. Is it the funding that's not available for them? Is it the awareness? So there are so many other things that are pegged, but we really have to put the user in the middle to be able to figure out all these challenges that stem from the user. Thank you.
Thank you. My name is Muhyiddin. Once again, Abdullah. I work for UNICEF. So of course, most people know that UNICEF only does with children, but there is a headquarter unit called UNICEF Supply Division that is based in Copenhagen. That's where we have the world's largest humanitarian warehouse. Apart from that, we also do procurement services. And in that, UNICEF actually has a global catalog that has a range of products, starting all the way from wash products to education products, to vaccines, to medicines, to medical equipments, hospital equipments, name them. We have such a big catalog, similar to what I would call maybe Amazon. The only difference is that our catalog is only open to UNICEF, other UN agencies, governments, NGOs, and CBOs, and the national and national NGOs. Only the corporates who will probably use our services to make profit out of it, and individuals are not allowed to use our procurement services. So where we are coming in, so we are also pretty new unit, probably I think we are around 5 years old, maybe, where we are coming is actually to add assistive products or assistive technology into that catalog. And for the first time last year, we managed to add 2 products into the catalog. So just to take you back, there were a lot of barriers that I think we've been discussed in terms of access to assistive products. So what we are trying to address on our side, I think, is the cost of the product, availability of the products, and infrastructure. I think for us, these are the 3 barriers that we're trying to address. So last year, so how are we trying to address this? So when it comes to availability, so we have more products into our catalog, which means more access to low and middle income countries, which is our target countries. Then we have the cost, which means we try to shape the market, having long-term agreement with global suppliers to reduce the cost of those products, as we also help them access the LMIC market. And then infrastructure, where we are working very closely with AT-Scale, WHO, and other stakeholders in trying to address the issue of quality, appropriate products. So making sure that whatever product that is there in the market is as per the global standard, and also whatever product that is being provided is actually appropriate, so that we don't cause more harm. So last year, as a step, we had 2 products into the catalog. So we had a range of wheelchairs into this catalog. So we have different type of wheelchairs, starting from hospital to postural to all the other wheelchairs. So we have range of wheelchairs, and we had hearing aids into this catalog. So we had range of digital hearing aids, and I can tell you, we had an LTA with, out of the 6 global suppliers, we have LTA with 5 of the global suppliers. And just to give you an example of how much of a price cut for those products, when I give you an example of hearing aid, UNFPA in Iran procured hearing aid through UNICEF Supply Division. In Tehran, one hearing aid that was going for 1,500, we sold them at $70. That's almost a 94% price cut in terms of that. Rwanda, we are working with a scale, AT scale. We did piloting there for hearing aid, and a price of hearing aid that costs for $2,000. Actually, they bought it through UNICEF Supply Division at $118. So this is what we are working on, and currently we have in the pipeline more products. So by the end of 2024, we actually expect to add 180 more products into our catalog, and this include vision product, which by the way we actually have our tenders open right now. So if any one of you are in the vision industry and you are interested to apply for our LTA, I think it's closing in 2 weeks. We have around 35 products that include all the way from individual to screening products. We are in the process of including digital AT products. We are in the process of including inclusive education products, and we are in the process of including incontinence products. That's almost around 183, 85 products that we are including by the end of 2024. So I think as the one with that also we do demand generation, where we try to reach out, being conferences, try to reach out to other UN agencies and telling them and trying to see that there is an uptake for those products. Thank you.
Yeah, thank you so much. So my organization is the Grand Assistive Technology Center, is in short GATT, is based in Ethiopia, in northern part of Ethiopia. So it's a social enterprise. So to tell you a little bit background on how it started, so we met Shona from Shona Cube, South Africa, 2 years back in International Society of Wheelchair Professionals meeting, and then we started talking about the issue of assistive technology. So I don't know if you know Shona Cube social enterprise, that's in South Africa, Cape Town. So it's a prominent pediatrics assistive technology manufacturing hub. So I believe it's the only ISO certified pediatrics assistive technology production facility in Africa. So they have been doing this work for the last 30 years. So they have made a number of significant impact. So that means they design and produce devices that are suitable for rural areas. So most the devices are durable are designed to work in rugged and rural terrains, and that are appropriate to the African context. And also, in addition to production and designing of devices, they also worked on systemic changes. So they influenced the national tender program, a lot of policies in South Africa regarding assistive technology, and so they made all this significant impact. So we, through our discussion, we decided to replicate this model in Ethiopia. So just basically do what they have been doing in Ethiopia. So, but just contextualizing it. So, as you know, so our center focuses on 2 things. So the first one is the systemic change. So in Ethiopia, the current assistive technology ecosystem is very underdeveloped. There is limited awareness, very limited financing, lack of policy, a lot of things. So this needs to be, there needs to be advocacy, capacity building, also lack of trained professionals, capacity building, all this, we call it part A. So we focus on systemic change, and the other one is we plan to start with assembly. So by first, so there are 3 options. As you know, we can import, we can do assembly, but we can also do full manufacturing. But we decided we are not there to start full manufacturing at this stage, so we decided to start with local assembly and move to full manufacturing in the future. So we are set to start this assembly soon. So that's just in short what we have been doing with GATT. And I agree with all that they say, that to solve the issue of AT, access to AT, I think putting the user in the center is key. But another thing is, I think what's very important is also people need to understand the value of AT. So there is also, I always wonder why is not many companies investing in it, why social enterprises are not setting up manufacturing and assembly units, but because they think that's not worthwhile. It's not worthwhile. But understanding the value, for example, what is the cost to society for not providing AT? I think it costs us a lot for a society by not providing assistive technology, because that means people are dependent. So there is also a cost for caregiving. Children do not go to school, do not participate. So it costs us a lot. So the cost of not providing AT is a lot compared to the cost of providing AT. So people need to understand this. Yeah.
All right. It's on. Okay, so thank you guys for introducing yourselves and getting deeper into what you all do. So just to set some context, this is a roundtable discussion. So I want to see a discussion happening. So it's not panelists responding to questions. And so to help us achieve that, I'm gonna just go back to the topic of the discussion, unlocking the AT value chain in Africa. And I want you to start thinking about what a value chain is, because then that broadens the spectrum of our discussion. So within this context also, I want you to think about who are the value creators in this value chain, who are the value consumers in this value chain, who are the value regulators in this chain, and who are the value distributors that make sure that that value gets to where it needs to go, and who are the value marketers, people that create awareness about this value, and then who are the value educators as well, and who are the value investors, and lastly, the thought I had, and you can add more, there's a lot of players here. You have people working at high levels, people working in country, people running businesses. So how do we start seeing it from the lens of an ecosystem? And I think we saw that the best way is to look at it as a value chain. And a value chain has to be connected, right? Otherwise it's not a chain. So in the context of that, I want us to start reflecting on where we are, right? And just to give some further context why this is important, why this is a significant discussion, is a statistic, which is that when you look at the gap of access to assistive technology, Global South versus Global North, it's a huge, actually unacceptable inequality, right? And we're not blaming anyone here, we're just stating as is. The lack of access here is 90% of people who do not have access to the AT they need, compared to only 1 and maybe in 10 in rich countries. So I think when you have that context, and then when we broaden the spectrum of the AT value chain, also to look at both digital ATs and hardware or equipment, because there's I think those are two parallel tracks, I feel, that are happening at the same time. And increasingly in the digital space, things are moving extremely fast. Look at things like how the digital world is enabling access to AT. Okay, so I've set enough context, and see a contribution from Chris. So, yes.
I have a statement that's going to sound like a joke, but I mean it quite seriously, but thoughtfully. But who are the valuers?
Yeah.
We need to learn to speak the language of leaders, of our leaders. And everyone's going to have different values. So there's not going to be one pitch that goes to every government, let alone every people in a single government. So we need to create not just an understanding of what's the right pitch, but who are we talking to? So that requires us to put ourselves in the shoes and the seats of the people we're trying to communicate with. It's inclusive design with leadership.
Yeah.
Understand what drives them, what are they being held accountable for, and use that and work backwards in terms of that down the chain. Because what this person wants is different than that person, and it might change where you are until the step 3. So we need to have a sort of, and again, also joking, inclusive design with leadership.
Absolutely. I mean, I love that. I love our contribution because at the end of the day, it's about people. Anything else in terms of the value chain, we need to, and by the way, you can begin contributing to the questions, and maybe we can talk about value creators here as maybe the first one, because that's where you'll have your manufacturers, that's where you'll have your entrepreneurs. So what's happening, I mean, in that space? Is it that we need more assistive products manufactured, or we just need to ensure that to correct this inequality, that there's capacity in these countries to remove that dependency on importing everything? And maybe Muhyiddin, you're in procurement, right? And you've talked about how UNICEF does it. How many of your 5 strong big players are from Africa?
Kind of put me in a spotlight. Honestly, they do have regional representation.
Yeah.
I think, but I really don't think they have.
Yeah.
The infrastructure that I talk about, I think the push to actually provide appropriate quality product when it comes to standardization of the product.
Yeah.
And for us, I think that's the biggest challenges in terms of actually having suppliers from maybe Africa's be having the LTA with us.
Yeah.
Maybe one thing that I haven't actually mentioned is our tender is a joint tender, WHO UNICEF tender. So actually whatever product that we add into our catalog is actually as per the global standard. We make sure that the standard in terms of certification and everything is actually in place.
Yeah.
So I know a lot of effort we try to advocate at the global level. I think also kind of supporting also the local suppliers to kind of pair their goals to kind of be able to be able to compete at the global stage. I think is the support that's required.
Okay, and that's a good segue, because now we've started talking about standards, and I guess there's also really a question here about global standards as well, right? I know some of the challenges we've had here is, like, let's take an example of wheelchairs, for example. I know we have, mostly it's ISO and WHO standards around wheelchairs. And there's always this question about chairs coming from outside, but the durability of those chairs is challenged by the built environment that we have here that is so rough. So while it meets a global standard, should Africa advocate for, like, even taking that standard higher to say, what's the cost of doing let's say you do a big procurement for wheelchairs for a country that has no pavements, and these wheelchairs will be used in the wrong environment. Yes, they meet the global standards, but is that a factor? Is that something we should be worried about in terms of, is that actually increasing the gap where, yes, you're trying to make wheelchairs as accessible as possible, but then what's the lifetime? And I think Pascal has something, and then we'll come to to Zalalem because I really want to hear your perspective with the South African experience.
No, I just wanted to just reflect on that point because there are wheelchairs that meet the global standards that are appropriate for a context where, for example, you don't have a paved road and you've got, just mud roads and potholes and so on and so forth. But then it comes back to the question a little bit that Chris was raising about the valuers of AT and what criteria do they use to make decisions around which wheelchair to buy, right? And the wheelchair that is appropriate for this context will probably be slightly more expensive than one that is not. And so, sadly, the way procurement is often done is that they just look at cost. And so they'll just go for the cheaper one. And so the challenge here is not so much the gold standard, it's those that are valuing the AT, how are they looking at this? And what are they taking into consideration? And so this is one of the levers that we need to, I think, try to influence and so, in a way, educate is, from the procurement side of things to really look at, the appropriate product and the quality and so on and so forth. And I just also wanted to say one thing around importation, because I think, again, I don't think it's correct to try to create a dichotomy around, importation is bad and local production is good. 80% of AT is manufactured in China. Most of the AT that is procured in Europe is imported from China. It may be from companies that are European companies, but they're manufacturing in China. And so, again, I think the key consideration should be, what is the cost of that product and what is its availability?
Yeah. I really love those two contributions because they really touched on, I feel like, some core issues around this. Because on the first one, then Muhyiddin, it's probably coming back to you. You're the one that makes that decision, And I don't know whether you've come across that need in terms of, do you consider, for example, when it comes to cost versus what's really needed on the ground, would that be a difficult decision? Because you have limitations, of course, in terms of budget, but at the same time, you don't want to take a product that will not last. And to your point on importation, I do agree, global trade is there, it's always going to be there. But let's look at the context of that importation, because maybe it might be easy for somebody in Europe or in the US to manufacture something very quickly in China and ship it without significantly increasing the cost. But how about here in Kenya or any other African country? Is that the case? So we're not saying it's bad. There is a valid conversation here about how do you make maybe international trade more appropriate to this market, and also how do you not ignore the local industry, because I think there's still a very strong agenda there, and we saw this with COVID, right? And I know people could say COVID is like once in a but what happens when our international trade systems are challenged, and we know the environment we are living in right now, how the world is. So I really want to bring Zalalem very quickly, and then I'm going to challenge the table. I like the hand, and I want to, just to bring in the gender balance, I'm going to give priority to our female roundtablists before we go to the men. But so let's have, do you want to go first or him to? Yeah.
I'll just say quick. I think the issue of the cost.
Cost versus quality.
Yes.
How do you?
I will also. I never say this, but most of how I normally start when I speak is actually say cheap is not cheap. So actually, it actually costs more when you actually buy poor quality products just because you want to save on that. And I think as Pascal has said, we actually have wheelchairs that can actually stand the rough terrain here in Kenya and mostly in Africa. So yes, there are products that can actually stand the terrain, that are specific for this terrain. But I think if we try to look at the cost, then we may end up also incurring more expenses just because we ended up buying poor quality product just because we look at the cost. Thank you.
Yeah, I agree with what Muhuddin and the others said, but I think one of the issues, with, for example, the benefits of localization is it improves, for example, there is a feedback loop. For example, people will get repair services, maintenance services close to where they are. It will create more, it will become more sustainable. And I think this is one thing that we need to also consider. Another thing is when products are coming into the country, for example, let's say at a free cost, the issue is they also impede local growth, local social enterprises or any industry that are trying to solve this issue. So it will maybe limit their market strategy, and also it will also limit further development. So I think this needs to be taken into consideration. And the issue of having standards, higher standards, I think that's very important, because as you said, the global standards may not work, I don't know, sometimes. So we need to have evidence, and the standards are very important, but it needs to be also enforced.
Yeah, because I think it's a context question as well. So I think I saw a hand, and before I give that hand an opportunity, I think you have something to contribute, Dr. Susan.
Thank you very much to the panelists. And so for me, I see children with disabilities, and one of the issues that we have is that whenever we talk about assistive technology, there are two concepts. There's the stigma behind it, especially for communication devices, and a mother feeling odd about pushing her child in the wheelchair. And so we need to figure out how to raise awareness and acceptance for our community. And then the second bit is whenever you're designing, and especially for you who's in Ethiopia, we have to take in context that children are growing, and the fact that parents may not be able to afford to keep buying at 5 years, at 10 years, and what are you doing to take into context for a growing child who has special needs?
I don't know whether there's any response to that, but I think there's something there you talked about that touches on the stigma, which I think is probably tied to the value marketers who creates awareness about this, and how are we doing in terms of awareness for assistive technology. And again, remember, the service side for assistive tech sometimes is always forgotten because people think AT is just for the products, but there's things like speech therapy. So rehab is also part of the larger AT ecosystem. So very, very important. I think did you have your hand up, or we go to Andre? Okay.
All right. So I would run quickly and then pass the mic. So for me, I think the key words in all of this is leadership. And I think broadly within the region, there is absence of leadership in AT. Because why all of the factors you have mentioned, the different value drivers might be there in isolation, there is necessarily no platform bringing it together to coordinate that effort, such that why is manufacturing in Ethiopia, we can then get feedback to then communicate to him to say, how do we manufacture to another standard? And in speaking about leadership, I'm asking myself, where is the after agreement in all of this conversation? Because if we are talking about AT manufacturing in the region and distribution, and we are not talking about our own regional agreements, but we are already talking about European standards, we're already talking about China, and we haven't talked about any authority in the region, then I think those are the gaps, really. And if we have, and that's a question of leadership in that space, which is perhaps where we should be focusing a lot more, because then leadership can coordinate all of these and invest, direct investment to where there is the huge gap.
Just to add to that, and to say great work for the folks who are already in the field doing the business. And going back to the question, how to unlock IT in Africa in connection to what is being said, I like to see IT in Africa as an economic sector. And I think that we kind of go through the charity approach where we see AT as charity, and we're not looking at what is the economic factor, what is the economic factor for AT in Africa? Like, what does it add to countries' GDPA? What does it add to skilling, employment, access to work, entrepreneurship, innovation? What does it add to the individuals in terms of economic or money or value for money? You asked the question yesterday, who pays for AT? Right. If we can look at and determine, I mean, there are over probably 100 million people with disabilities in Africa. How many of those needs AT? And what does that mean in terms of economic factor? I think if we change our mindset and shift towards thinking, how do we use AT to improve GDPA, economic development in Africa, and show the money value, I think there'll be a shift. Because if we have manufacturers, if we have suppliers, if we have a clear value chain, people will have jobs. If we can connect youths or people with disabilities to those jobs, there's going to be growth in the economy, basically. So I agree around leadership, but I agree that we should probably shift our thinking. And I'm not really a big fan of importing. I think that just, like, I mean, who does that help, basically, right? And you talked about sustainability as well, right? So how often do we keep depending externally for systems that should be driving our economy, basically? So I think that mindset should be something that we should look into as well.
Wow. So I want to bring in, just before that gets cold, ATScale did an investment case for assistive technology. It's actually publicly available. Pascal, do you want to tell us a little bit about what impact has that had in terms of shifting the mindset that, because I think it talks even about the return on investment. Please.
Yeah, thank you, Bernard. So yeah, indeed. And so we ran some numbers and did quite extensive research on this, and we came up with a 9 to $1 return. So basically, for every dollar invested in assistive technology, there's a $9 return to, the economy because of better education outcomes, better employment opportunities, longer productivity of people, et cetera, et cetera. Now, that's a macro level global number. It only takes you so far. When you're actually trying to make the case at country level, leaders often want to know, okay, what does it really mean in my country, and what am I, and so forth. And so we are now embarking on doing country as sort of specific investment case to kind of drive that advocacy and address also the leadership question that you point. And I think one of the challenges with AT is that AT has not existed as a sector, right? AT has been a fragmented set of different things, right? But the idea of considering AT as an ecosystem, as the products and the services that go with it, and looking at all the domain areas together in a systematic way, that is relatively new, which might explain why there hasn't been the leadership that we're hoping yet to see. But I do see some positive shifts there, and to keep the analogy of the chain, I think we need to find ways to grease the chain, because while we're all for market forces and to work, and we want to end up with a system that is sustainable, and that's only if it's sort of a system that is driven by market forces as opposed to charity and so on and so forth. Right now, I still see that there are huge market failures happening, and the biggest one actually, and I know one of your colleagues from supply division is always saying this. The problem is the demand. There is no demand or I should say more accurately, there is no funded demand, right? There's massive need. We know that. The number is only 10% coverage. There are millions of people on this continent alone that need AT. So the need is huge and it's there. The problem is there is no money to pay for the AT, right? It's too expensive for individuals to pay out of pocket for it, except the lucky few middle class, upper class in the capital cities. Governments aren't, covering this as part of their social benefits. I mean, again, it's starting to. We heard this morning from the DG Health of Kenya, the Deputy DG, that is now starting to become included in some of the social and health insurance packages. But it's really just a very, very, very beginning, right? So you don't have that, and you don't have a big external funding source as well supporting this to kind of grease it. The way that we saw things happen in vaccines or in HIV or in other areas, it did require a massive influx and push of external funds to grease the wheels, so to speak, and make, really trigger something. So we're trying to do that with AT Scale. Obviously, we're not there yet, but I think we're seeing a huge momentum. And this is a really great conversation because we need to more and more come at it together. Just in the last 18 months, we've been able to double our funding base, for example, in a very constrained funding environment globally, right? And in an area that typically has been neglected. So we are seeing a shift and an opening of the mind and some increasing awareness, but we've got a lot of ways to go, but I'm positive.
I mean, thanks for that contribution, Pascal. And I really want to pull in Brian here because it's something you said about demand and the idea about users versus, consumers. Value, we are the value consumers here. And also just within the context of talking the economic value of AT. So Brian, you're an entrepreneur. You've been building a number of products on AT as a business. How has it been for you in terms of this question of demand? Where are the buyers? How do you increase the purchasing power? Because I feel like when you look at it from the lens of the macro lens of the status of people with disabilities, we all know that a lot of people with disabilities would be classified as, especially in Africa, as in the poverty line. But it's in the same country where we've seen other sectors unlock people that have been for a long time written off as poor that cannot afford. Whether that's financial inclusion in this country with M-Pesa or access to electricity and power. So I really want you to speak to that idea, because then it would kind of help us focus on where do we start creating that demand. And if you're running an AT business, or if you're making decisions about investing in AT on the continent, then where do we start? Where do we start putting resources?
It's a huge question, Bernard. I think just to agree with Pascal first, there is a lot of need for AT on the continent. As an example, right now we're doing distribution for various assistive technologies here in Kenya, and we've brought in 30 new products that did not previously exist in the market. In terms of advertisement, you'd get, we're putting a lot of resources in advertising, in creating awareness about the availability of these products, but then you get 300 inquiries before one person is able to buy. You look at the return on investment on just the advertising itself, it really doesn't make sense. But in terms of the need, clearly there's a really huge need. We said 100 million people with disabilities. When you look at other sectors with a market of 100 million, the resources that go into that to create systems, to create infrastructure, there's a lot of resources. But then when you look at AT, there's a huge market, but when you compare the resources, the funding going there, it's very, very little. So as innovators, I think AT innovators are the most underfunded and the most oppressed of all the innovators. Yeah, but the resilience that exists within these innovators, I mean, it's just really, really encouraging to see that. We were in a conversation discussing manufacturing manufacturing 80, local manufacturing of 80. And one of the things that comes up is there isn't enough demand. So personally, I feel like we need to align our interests so that I really like how you've broken it down, Bernard, value creators, value marketers, value distributors, so that we don't have duplication. I think there's so much need that we don't need duplication right now. We need to work together and mobilize the funding that's available to solve the bigger needs. We are affected by policies, by importation, by taxes. So if there's a way we can, I think this platform is amazing. If there's a way we can agree, let's focus on these areas. Let's push these big areas, and they'll unlock these opportunities for entrepreneurs. I think as value creators, once you start building something, you realize there's so many barriers ahead, but it would be so good to see some of these barriers eliminated for entrepreneurs who are coming to innovate in this space, so that we don't kill the hope of all future innovators. We really need a lot of innovation and a lot of local innovations for AT. Yeah, thank you.
Wow, thanks, Brian. I like that I'm seeing hands, so I'm gonna allow one more hand, but then after the hand, and okay, 2 hands, and yeah, okay, 3 hands. So let's get in. Yeah, I like this because it's a discussion now. So we'll start with. I'm gonna keep to my promise of prioritizing the female roundtablists, if you don't mind, because we don't have a representation on the panel. So we're gonna start with you, and then we're gonna come to you last. You can say hi, and then you.
Thank you very much for this very rich discussion. My reaction is more around the demand piece, to say, do we really have enough information to equip the value creators with so that they're able to effectively generate this demand? Because I believe they're a very important actor in this demand creation. So 2 things came to mind. Firstly, when we are creating these products, are we creating visibility into the life cycle of these products? So it's probably not enough for us to distribute and end there, but are we informing our valuers with what the full life cycle is to create that value and then generate demand? And then secondly, when we're talking about putting users at the center, to me, I see that as, are we creating awareness of what the actual journey is for the user and the different parts of the value chain they're interacting with in order to then appropriately create this demand? So for me, those are the 2 things that jump out: the life cycle and how the user interacts with all these pieces in the system. And I believe that will create the demand.
It's a powerful contribution, and I'd love people to keep that in mind, because then when you look at it like that, it doesn't stop at the product, right? So who's gonna repair the product? Who's gonna do all those other things that go around maintaining that value? Okay, so we'll come to you. Did you have a contribution before you go to him? Sorry, I'm being...
Hello, everyone. This is Mariah Moon from Google. I just wanted to thank everyone for all their comments so far. I really appreciate what everyone's been saying. I just wanted to add one other point that I've been thinking about since coming to Kenya, which is I'm seeing a lot of people with Android phones. And I think what I'm realizing is that discoverability is a huge problem. There are a lot of assistive technologies that are built into our phones. They're built into our computers today. And after Nimmer and I gave our Android Chromebook talk, I've had so many people come up to me saying, I had no idea all of this was built in. And I've helped people put live transcription on their phone to help their students who are deaf. And I've shown people Chromevox to help people, Chromevox and TalkBack, to help some of the people who are blind who might already have an Android phone. And so I think discoverability, I think, is a real something really that's coming out of this for me, which is there's a huge opportunity for us to just tell people what's available already for some of the devices that they already have. Thank you.
That's amazing. And I think it goes to the idea of value marketers. It's really that awareness piece and yeah, because if you don't know, you just don't know. And yeah. Now we're finally.
Okay, finally.
You rightfully have the mic.
Okay. So this is a very useful discussion, actually. But I would like to go back to the thought about, localizing the industry, if you wish, and go to a more basic thing. When we're talking about assistive technology, what is really meant and where is the added value is. So do we mean the content or the accessible content? Do you mean the accessible services? Do you mean the tools, whether they are software, they are hardware? Because those things depend on other or close gaps, and to start within a reasonable and sustainable process as well. Because it's also it's linked to the education, to the research sector, it's linked to the entrepreneurial sector, it has a financial impact. And to be frank also, without a proper market research and financial impact, it's not going to be heavily sustainable. Are we talking about services? So maybe this is localizing services, this might be, something. And accessibility of the services as well. So all of these things, it goes into mind when we are thinking about, developing something or supporting an innovation or whatever you call it. So, thank you.
Wow, I feel like he opened something up. Yeah, or a kind of value, because I think there's a question of value addition, which I had not really thought about in the context of localization. Because I know, like in Kenya, in this country, 2 years ago, we actually localized the European standard to create our ICT accessibility standard. I really you were part of that process. So I don't know when you think about it like that. For me, I look at, you need both accessibility and assistive technology. If the two are not present, you still might have somebody with the AT they need, but they're not enabled to use it.
Yeah, actually it goes also into early intervention, prevention, and goes into sports medicine. So there are lots of aspects. So it depends, what do you mean by assistive technology exactly? When you're putting an education, accessible education content, right? For example, let me give a very close example. ChatGPT 4.0 just came up with a scene description. You can just see it on YouTube, right? And they're using heavily computational power. Google just had their, conference, closing conference, and with all of these new amazing technologies. Before this, NVIDIA, So where do you want to plug in? How are you going to use these things? Where is your added value going to be? So.
And there's also the other version of localization.
Yeah.
Language. In your language, it might as well not exist. If you don't speak the lingua franca or lingua angla, it doesn't matter. If you can't understand what's on your phone,
you lose.
Wow. So I feel like we're picking momentum here. We're about to go to some another gear. But I think we are getting actually more questions than answers, which is a good thing sometimes when you're trying to solve a problem. Because if the answers were very obvious, then... but just to take us back to the idea of unlocking, because yes, we've talked about value chain, but are we really unlocking? Are we addressing barriers here? I think there's something that has been brought up. Had it from Andre, I've had it from Brian, and it's, for me, the question also becomes: can you unlock the AT value chain without entrepreneurship? Is it possible? And when we had a question on leadership as well, but for me, it's entrepreneurship is about solving problems, right? So how does that look at the moment in this space of AT and accessibility? Klaus, I feel like I can read your mind. You're like, it's such a waste of time. What are they talking about? Anyone with a, I think I'll give it, had a hand, yeah? Oh,
You had a point. I thought he.
No, I would like to come back a little bit to the thing that that was discussed before, because while he was speaking, I looked in Google on the theory of market, yeah? And we never spoke about this, about the theory of market. When we speak about a market for assistive technologies, yeah, then look at the macroeconomic side of market. Yeah, what are the preconditions in theory? Yeah, we have homogeneous products. We have no preferences of the participants in the market. We have many demanders and many offerers. We have transparency in the market. We have reaction time, which is going to zeros of all the market participants, and all the people that are participants in the market have to act in a rational way. If we take these 6 theoretical preconditions for a market, tell me, is any of this really valid for the assistive technologies market? I don't know, but I don't think so. Yeah, because we don't have homogeneous products. The preferences, we have preferences of the market participants. Yeah, we haven't. We have no transparency of the market. Yeah, there is the reaction time of the market participants is not slow, or is very slow. Yeah? And the market participants, they are not acting in a rational way. So can the AT market ever be a normal market? That's my question now.
Who's gonna be the brave soul to answer that question? I like it though. Pascal, yes.
Everything that you've said is, a lot of it is actually true, and I think that's also what drove partly the creation of AT Scale. That realization that, there's so many market failures. We need to look at this in an integrated, systematic way, and so forth. Can we ever get to it? Yes, I think so. I'm not trying to ever call it a normal. I don't know what a normal market is. I think there are many different markets and types of markets for different types of products and needs. Can we ever make a viable AT market? Yes, but I think it'll never be a fully, purely driven by straight market forces and entrepreneurs and so forth. I mean, again, if you look at the more mature AT markets in the US or Europe, government involvement and subsidies and all of that. Without that, I'm not sure there'd be an AT market in Europe either, right? So I think this is always going to be a very complex market where you'll need to have strong government role to enforce regulations and quality and this and that, but also to a certain extent subsidies, because costs, the challenge, one of the challenges is lack of homogeneity, right? And so it's difficult to really go to scale because products often need to be so tailored to individual needs. So by definition, it's always going to be hard to reach that one. Maybe for some of the AT, but not for many of them. For the digital ones, perhaps, it might be easier, but for some of the other ones, less. And so I think it's just a question of understanding what are the limitations in this market, and then trying to figure out how do we then accommodate those limitations and account for that. And I think that's why you will always have some role to play here of grant funding, of course, government resources alongside the private sector and so forth. And when I started this role, people were talking always about, market shaping. But actually, we're not talking about market shaping because there really isn't a market. We're talking about market building. And that requires investing into the system to create that enabling environment And I think everybody needs to understand that. And I think even the private companies and the entrepreneurs and the innovators need to understand that. There's not a ready-made market where they can just easily sell their product. They'll need to also find ways to contribute to strengthening and building that system. And it's on all of us to help do that.
All right, it's on now, I think. So I just want to build up on what Pascal said with regards to government. So Kenya launched the rehab strategy and assistive technology last year. And of course, our vision for us as clinicians, as Ministry of Health is guiding us, is that how do we, you're talking about what the entrepreneur needs. For me, I'm talking as a doctor, what does my patient need? And so the role of government in trying to bridge the gap between us is really important. And I feel like some of the contributions that we have to make, as he had said, is that can we get government to now take it as a campaign where, like the same way we did a vaccine campaign, can we have an assistive technology campaign, because it's expensive, people can't afford it, and you're there innovating a great product that I have no idea about and I want to know about, but who's the middleman who's bridging this gap in bringing us all together? And I think government has a role to play in bringing all the stakeholders together so that we can have more of these conversations to know, there's a locally made product. I don't need to write to an insurance company begging them for an expensive thing to be imported elsewhere because I just don't know your product exists. And so this creates a forum for us as the healthcare providers and you as entrepreneurs to kind of have this conversation, and hoping government and UNICEF and WHO can bring us together so that we know what's available and where I can go online and just access that service. Thank you.
Here you go.
Yeah, thank you so much, Irene and team, for this forum. I want to say something on my personal view, but also on the part of the regulatory entities. I think one of the speakers had challenged the regulatory entities to do their part. And Bernard specifically created a question for us. What is our responsibility in unlocking the AT value chain as regulators? I'm happy the government spokesman is me here, so I will say very few things. Then he will take everything that government has to take. Yeah, but just this morning, the Communications Authority launched its 5th strategic plan at Serena, and the Minister for ICT was there. And one of the areas that he pinpointed out of this strategic plan was consumer empowerment. I think as we speak, innovators and Brian and team are very many people, but they are not getting the right demand. And perhaps the people who are still struggling, yet they need, is large, and we can see it right on the streets and in many other places. In our strategic plan, key result area number 3, the first item was to promote digital empowerment for women, youth, elderly, and persons with disability. Now, when the conversation was going, I looked at this in detail, and I was wondering, how shall I get enough content to be able to do consumer empowerment as a regulatory officer? And the answer just came from this room. And I'm going to make Irene the source of information for me to do consumer awareness. But good enough, she already found Google. And madam, you said the devices here we have solutions, but we don't know them. So can you share a document that says on your Android, A, B, C, D are the ATs and you can use them? Then I will amplify that information in my consumer marketing and empowerment programs. As a regulatory entity, I will require the licensed entities to also do the same whenever they are doing their consumer outreach or they are informing their customers on the products that they offer. But we will be doing that based on information that is properly grounded, that is verified, that is tested, and that is actually able, can be enforced. So that when we say we want to ensure that the products that come into the Republic are meeting a particular standard at the customs level, we will have tangible information. If we are challenged to test, then Google, Meta, and other colleagues will tell us, if you are testing this, come to this particular lab. On our own, in customizing the European standard on accessibility, we have developed a Kenya Standard 2952, which now we are using to implement accessibility to ICTs. So that will be our leg, but that's only ICT regulatory. Maybe the government in a bigger way can answer many questions. Thank you.
So actually, before I invite Isaac to say something, I think I also want to challenge the private sector companies, especially Google and others. Africa is a mobile-first economy. Majority use Android phones. I agree with you, there are a zillion accessibility features on these devices, but the problem is awareness. So as much as we might try on our end to create awareness, I think we need to collaborate and see from your end, as a company has developed these products, what can we do to create awareness? Because some of these tools are very beneficial to anyone with a disability, and it's important for people to know about them and have the choice whether they want to use it or not, especially when they're free and they're provided readily available. I think that's good. So since you've gone to Isaac, let me give Senator Isaac, Honorable Senator Isaac Mwaura, a chance to say something. Please proceed.
Thank you very much. And I'm here with my team from the Office of the Government Spokesperson. I have Lydia there and Anisha, and I'm sure some other people here, Maina and Brenda. I am happy to be with you. I was supposed to be here yesterday, but of course my office is extremely involved in many things, including the current national flooding situation. And so therefore we have to inform Kenyans of what the government is doing, because my office is the face and voice of government. And it is important then therefore to say in matters of inclusion, from being the voice of the voiceless, the voice and face of government is a person with disability. I think that for me is important. I'm a person with albinism, for those who may not see me. And so therefore, as you may have caucused, and you are the subject experts in this regard, the Kenya government remains very committed to ensuring that we have that inclusivity when it comes to technology. But then also it's a question of power. It's a question of affordability. It's a question of awareness. It's a question of access to information. If you're in communications, we would also say it matters who is very close to the camera. You see, that kind of thing. And so therefore it speaks to the whole issue of underrepresentation. It also speaks to the whole issue of empowerment of persons with disabilities. And in this regard, therefore, we have some trainings that are being done in terms of that inclusion of communication. And by the way, my office has a dedicated section for disability communication, so that then we see how we can leverage on technologies to bring information to the people. It's a novelty, really, because that is not something that has been done before. And we are looking at how, for example, we can leverage on AI to leapfrog some of these challenges that are associated with the digital divide. And also, just to also emphasize the very supportive support, very, very supportive policies around the digital superhighway as a key pillar of the Kenya Kwanza administration. We have 5 pillars, and one of the 5 pillars is a digital economy, the creative economy through the digital superhighway. So we are very keen to ensure that then we bring people to the marketplace. For example, we have been talking to Safaricom to see how they can have special platforms for persons with disabilities to leverage their talents and marketize and commercialize such opportunities. So there is a lot in terms of, for example, learning, and affordability and such programs within a very limited resource envelope, within a shrinking fiscal headroom, but it is possible. And I'm sure through this conversation that we are having here, Irene, we will come up with ways and pathways. And that's why I want just to give my commitment as the government spokesman that our administration is very keen, whatever resolutions that we make, whatever conclusions that you make, and we have very good people here, including my friend here, Bernard Shira, we will be able to move them forward in solidarity, because the voice of government is the voice of a person with disability. I thank you.
Hello, everyone. Been listening to these conversations, and it's been very enlightening, taking a lot of notes, very much learning a lot from you about these challenges. And like Mariah, I've also observed that there is a struggle with the awareness aspect of that. And so, you know, on working at Google and on Android side, certainly that awareness piece, like we can work together to help with some of that. In what capacity, we'll discuss that and work that out. Maybe trainings, that kind of thing. What strikes me too is that there's really a need for that research to figure out. I think, like, you know, are our tools actually working for individuals here? Like, we have a lot of these tools, but are they working? And so that's one thing too. I've gotten some feedback, like someone said yesterday, like Lookout is identifying a microwave as a TV screen. Getting this kind of feedback and getting that research done is you know, that's a really important piece of this too, is to make sure that the tools that we do have are actually working. Another piece that really I've noticed is we're at the School for the Blind in Mombasa. I got a nice visit there on Friday. And one thing I took away is that apparently students there are not being trained on mobile phones. They're not allowed to use them at all. And so even if they had a lot of these tools, I'm not sure that they're actually learning about them. And so this seems to me like maybe a policy question of you know, I understand there are reasons behind it. But as a blind person myself, I can say I do use my phone quite a lot, and there are a lot of apps. A lot of them, some of them were discussed here, and there are a lot of enhancements to break down some accessibility barriers. Certainly, there's environmental challenges for accessibility. I'll point out one thing here in this hotel. The elevators have Braille, but none of the room numbers have Braille. And so if I want to navigate this hotel, I can get on the elevator. Hopefully I can find it. But I can open the door and I can get on it, push the right floor, and then what do I do? How do I find my room? Right? So there's still environmental challenges. But yet, using a phone app, I can pull the phone out, and using an app, I can find out this information. So it is about awareness, but I think some of that is a policy question of, like, why are there awareness challenges, and how does a combination of government, education, Google, private sector, how does it address that awareness piece and that education piece as well? Anyway, I babbled on enough. Thank you.
All right. Do you have any other contributions? And now we need to start. Yes, we have one more here. But as we get these final contributions, I want you to start getting into the mindset of what's your responsibility, what's your contribution, what are we going to do? Because then it's nice to have a roundtable like this and discuss these issues. But I think the most important thing is the output that can influence the change we want to see coming out of this roundtable. So if you're a funder, if you're a private company, if you're a regulator, whatever your role is, it's a good time now within that AT value chain conversation around value creators, value consumers, value valuers, as we had. This is the right time to start thinking about those practical things that we can do. So let's have the contribution from
Renita.
Okay,
yes.
Go ahead.
So I'm glad you mentioned that, Bernard, because that's where I was actually going. And I was going to talk about, so I'm often thrown out of ideation sessions because I like structure, and so I feel there's so many ideas and so many things we've talked about here, but I will speak for myself. I will walk away in confusion because I don't know where to focus. There's so much that we've talked about. And I think then I take it back to the contribution from my colleague who talked about the leadership. To say, are we able, there's so many things. You've talked about value chain. I think I heard about the need to understand, so what is the business model around assistive technologies? Are we going to, it's not realistic. I think I'm hearing to expect that this will always be, it's just like funded directly from, like if you look at the private sort of sector model, that may not work. We've talked about information that's missing. We've talked about standards. What I picked from the financial inclusion space, and I've seen it in several countries, is that you have all these ideas, but what's good and what is most effective is to come together the way we have today and talked about the ideas, but then can we prioritize and look at what are the things that, that we need to focus on, so that then we put that in a list and we say, we want to focus on this, and in the room, this is the right, partner or entity that can drive that, so that when we meet next year, it's not another round table where we're throwing, again, ideas at each other. We might have advanced a little bit in our own separate spaces, but I can almost feel that we would still be here talking about the same things. We've talked about needing to have more information. So I'm wondering whether, since Enable brought us here today, can we walk away with some, maybe not in this session, but if we can put together some of these ideas and then say, this is where we need to focus, so that when we come for the next week, we don't even have to wait a year. We can come back and then say, okay, so who wants to lead this work stream? What are you bringing to the table with what you're doing? What information do you have? How can we work together? Because I fear that we're so many. I am overwhelmed by, I think it makes sense. I understood that the different types of assistive technologies, some of them are easy to scale, others are not, because of the differences in the needs and the need to customize. I feel like if we don't put those buckets and we don't understand, we will not really move a lot. Or we might move individually because we know what we're doing alone, but the progress we would have made together, we will miss that. So I think my ask is, can we just prioritize some of those things and say, this is where we need to focus for the next 5 years. This is our plan. The way governments do maybe financial inclusion plans. And then we have commitment, solid commitment, and then we can measure against that and move.
I like the sound of that, and I hope that we've been taking notes and stock or thoughts of things. I think the purpose of this platform really, one, is to create an environment where we can hear what's happening and know where things are. But I think if we do not move to that next stage, then it will just be a nice conversation. So part of what I know this conference does is that for every session, there's actually going to be an output of what was discussed and the key ideas to take forward. But I think what I would probably add is, if this group here wants to, within a year, come back and feel like our contribution, our discussion contributed to something, I think that's something that is open. But I know in the larger scheme of things, this is very important for players or everybody in this room. We came to understand so that we don't replicate, so that we know who's doing what, and so that in our own individual organizations, it can be easier to create an output. I think if you're familiar with group assignments and in school, it's possible, it's very easy to come around a group and say, okay, let's discuss. But when it comes to submitting the assignment, it's usually 1 or 2 people that actually go ahead, and this is expected. But my challenge to all of us is be that 1 or 2 people that will come after this roundtable and reach out to Enable and say, let's actually drive this change. And we have the pleasure of having here, I think, a very good representation from private sector to government. So I know even Isaac wants to know how can he help the outputs of this discussion and get the ear of the government. So, and we can start with Kenya, and if it works, how do we now start looking at other countries? Yeah, so I think we want to wrap up. So maybe it's going to throw this back to our amazing panelists. You've had a lot, you've reflected a lot. But I think you can help us, especially from that last comment on how do we move forward. You know, what would you like to see in your position that can make your work easier? So Irene, we're talking about how do we now bring the outputs of this discussion into something tangible. There's a need here for leadership. I think you had an additional point. I don't know whether you still have it. Could throw it back to you very quickly, maybe within a minute.
All right. So I was just trying to summarize everything in my head using like a 7A framework that I already have before, but just putting all of this. The first one is awareness, which is what we've talked about. The second one is affordability. There's also availability. I think the first is it available? Are people aware about it? Can they afford it? Then there's a D around ability. Can they use it? And then there's one around adaptability. And speaking of that, I think part of what we should also promote is not just innovative entrepreneurship, which usually take a long time and a lot of resources, but how about adaptive entrepreneurship, which sometimes is easier, faster, and you can jump around different products and adapt it. Right, and then the other non-tech-centric conversation is around agency. You know, the agency of persons with disabilities and the attitude. Pretty much talking about the government, the policy attitude, and how all of this come together. So this is just putting all of this conversation in that 7A framework to help us remember. And of course, wrapped around that is leadership. Who coordinates all of this? Thank you.
So some closing remarks from the 3 of you, and then.
Yeah, thank you. I think such kind of discussion is very important because one of the challenges with the AT ecosystem is it's being fragmented, so different people doing in silos, doing similar work. I think some kind of coordination and meeting and learning what the other people are doing and how we can collaborate and move the agenda forward so that we don't compromise. The ecosystem is really great. I think collaboration is very, very important, and raising awareness about the value of AT, I think, is critical and should be the priority. Yeah, thank you.
Thanks. I think we have a very rich discussion here today. I'm really happy about this. One of the things is, I think there was a question that was raised that. So what actually are we doing? Is there any goal or is there any step that we're actually taking? And I think, to be honest, I have been long in this sector, and for the first time, I'm actually in a forum that actually we are discussing when it comes to product. This has never happened before. By the way, I'm also from Kenya, and I know the products that we have there. I have practiced here in this country, and I think also mostly also in Africa and also in Asia, and I know the quality of the products that actually we have there. So I think it's actually positive that actually we have having this roundtable discussion. We are having, I think every sector is well represented here, and the discussion, to me, actually, this is a big step to actually that we are actually having such a forum, and I think thank you, Irene, for organizing this, and I think probably I expect that with this, we'll of course go home with of course a focused mind that But yes, there's something needs to be done. I know there is the issue of regulation. For me, this is always a priority. I think I keep on talking about this. There's leadership, there's financing. I think that needs to be done, and others. So we look forward to more forums. If you need to invite us, Irene, feel free to invite us. We will be able to join you virtually anywhere. If you think maybe in 3 or 4 months you need to we have some action points that we need to follow up, and we need our contribution, we will be able will be available to support you. And I need to thank everyone for their rich contribution, and thank you.
Thank you to the organizers of the event for inviting a startup. So it's really good that we have the voice of some, I think, different perspective from most people in the room. I'm very fortunate. Mine is a private company, so I'm not tied to goals and reports and all those things. But then, unfortunately, it's a startup where you, I think, Steve will say, you have to fly the plane as you build it, so to say. But what that allows us to do is to really innovate quickly. Personally, I believe there's a business model in assistive technologies. We've brought in products. We are trying different models to sell them, to find the right person to buy. And as a startup, we can innovate very quickly. We can change tact very quickly. For me, it's next year when I come here, I'll be very happy if I can come and present a viable business model for funding AT and distributing AT within Africa. Yeah. I'll just conclude with one example. So when I started building AT 8 years ago, I met one lady. She was 45 years at the time. She lost her sight 10 years before, but she didn't do much for those 10 years. But when we started testing our product, she was really inspired that there's a hope for better technology that will come up. So she went back to school, and I just met her a few months ago. She has a job. She's really living her life. She was on holiday. Those kinds of things that she could not have imagined she would have done before. And she was one of the first customers for our new products. So I think that cycle of empowerment, from employment of persons with disabilities to education, it's a really huge cycle that comes back to people have the funds to buy these products. So I think there's a role for everyone here, from government, from private sector, from regulators in enabling access to AT across Africa. Thank you.
So thank you so much, Brian. Let me start by saying, by the way, we understand what it is to be a startup. We've been a startup for almost 15 years. We're now transitioning. So we believe in what you're doing. And as you know, we're very passionate about innovators. That's why we have the AT Village downstairs. If you haven't been there, take time and go and see what our African innovators are doing. And I'm sure you're seeing the quality of the people we have. And the reality is they still need our support. It's just figuring out where can we support them. And I think, as Pascal said, the reality is for the AT market to work out, there has to be a balance between government, private sector, the innovators. It has to be from all angles. So the whole point is, when we started off, I started by saying we have no idea what needs to be done in the AT, in the whole AT ecosystem. But the beauty of this meeting is we've brainstormed. Everyone has come up with their own ideas, very different. So we'll put the notes together and we'll map out something, but the goal is for us to map out the ecosystem and also figure out where do we need different people to plug in based on your expertise, based on how you can contribute. And then the whole idea is to make sure we don't have gaps. We could be focusing on all these other innovations from somewhere else, and then our innovators are here innovating, they're doing really good, but they can't get into the market because they don't have the capabilities to do that. So we want to make sure that we are able to work collaboratively. So I agree with you, it's not a one-man show. Even Enable can't do it alone. Bernard and his organization can't do it alone. It's all a collaborative effort. So this is the first of many meetings. We'll be calling more meetings for discussions. Just know we're building this together. We're figuring this out together. Don't come into the meeting thinking we have it made. No, we don't. And if you come with that kind of mindset where you know I'm going to contribute, someone else will have a better idea than me, then we'll be able to really come up with some good solutions. We may have 10 problems. If we solve 3, that's huge by itself. You get, so that's a way to look at it. We have to celebrate every milestone. So having said that, I want to say thank you to each and every one of you for making it. It's been a long day. It was after lunch, so some people are feeling a little sleepy, but they still contributed. But please enjoy the rest of the conference, and thank you so, so much. And Bernard is here, I'm here, or anyone else, if you have questions, happy to support.